Welcome, past students. My name is Dr. Jorge Montes, coming to you from the DHR Health Eye Institute. I would like to share a little bit about how I got here and how my career kind of came to be. So first, most doctors actually have a very similar foundation, all of us. And then we deviate based on what we want to do. So I'd like to share with you how I actually came to my clinical pathway, but just keep in mind that the first portion of what we do is very similar in any specialty that medicine has to offer. So first, the good foundation to anything is going to college. So obviously before that, you have to finish high school, get your diploma. The big next step is college. Even recently, college has been one of those things that has come to question as to whether you need to do 3 years or 4 years. Many people do end up finishing just 3 years as long as you have enough credit hours to proceed and to apply to medical school. But for the most part, most people will decide, since you put that time and that energy into actually finishing the 3 years, you don't want to finish and not have a degree. So most people will take those 3 years and actually finish off the next year so that they can not only have their medical degree, but also a bachelor's degree. And it does not matter whether you get bachelor's of science or bachelor's of arts, or just a bachelor's degree would be sufficient. A lot of questions come from whether you need to get a science-related degree, or can you do a liberal arts degree, a political science degree, or any of those degrees. And honestly, I did get a science-related degree, but standing here now and looking back, really any bachelor degree should be sufficient as long as you have a core requisite, which is a standard that everybody should look into. A couple chemistry classes, some organic chemistries, but if you can do that along with any other interest you may have, it would be nice. Thinking back, I probably should have done things that interest me more than this science, but at that time I was focused on the goal at hand, which was to become the best science student that you could be, but that doesn't have to be the case. If you have a passion in arts or anything else, you can get your degree in what you're interested in. Medical school, even more so nowadays, starting to look at very well diverse applicants. So the applicant pool, making yourself diverse. So having that unique separation between you and the next person. So maybe having an interesting background in economics, or which is also really important in the field of medicine. But after you get your bachelor degree, the next step is medical school. And this can seem daunting. This chart here can seem very daunting, but then the very next step is another 4 years of medical school. And this would be the last 4 years that you're going to pay to be getting trained. College, you have to pay to go to school. Medical school, you have to pay tuition. But after these 4 years, thereafter, although there's still more training to do, you'll be paid something. At least you're not having to borrow more. And so I think that even if we just take a moment to stop here, this at the end of this career is what's daunting, because you have the 4 years of college, 4 years of med school, and some people think that 8 years is too long. But through my own personal experience and through having seen my own friends go through similar different career changes, I've realized that even at the end of those 4 years, when I was finished with med school, after 4 years of college, there were still a lot of my friends that were still kind of bouncing around their first couple jobs. And by the time that they're done with their second job, maybe 2 years at one site, 2 years at another site, you'll be done with your medical degree. And that would be very, very, the MD degree was something that I think by that point in time was very stable. So at that point, I had a lot of friends that were already stable into some careers, but some were still jumping around. So I don't see it as a negative, other than that I had to pay for, I didn't earn income during those 4 years. But don't let the 4 years of college, 4 years of med school be something that prevents you from doing it. As long as you don't stop halfway and decide to change at that point, because you'll have a lot of debt and student loans. But thereafter, after med school, you have to do an internship. At least to, now speaking more specifically, this is where we draw the line between all doctors. All doctors have to get a college degree, and all doctors have to get a degree from a medical school. There are two big types of medical degrees that physicians use, and that's Doctor of Osteopathic Medicine, and then that's a DO, and then you have Doctor of Medicine, which is the one that most people know about as an MD. And then here in the United States, they're equivalent. The testing's the same. It's just a different approach to how you're going to treat your patients. Here's where I decided to move on and do more specific training towards what I'm doing now, mainly eyes and eye surgery. And so I started off with an internship, which was 1 year in internal medicine, which was a paid internship. And then I did thereafter 3 years in ophthalmology residency. So that's already putting you at about 12 years after high school, which again seems daunting, but really once you start your internship, it's like your career now. You're practicing medicine. This is what you're going to be doing the rest of your life. So don't look at it as further schooling. It's just more training. That it's already start of your career. But things that have to be done in order to actually start practicing in your subspecialty. So since then, at least personally for me, I've been in practice almost the full 7, going on my 8th year now. So that's about where I'm at in my career path. So practicing for 7 years. And let me tell you, it goes by way too fast. Looking at this personally, I did go to Texas A&M for my undergraduate. I got a bachelor's in biomedical science, which again, going back to the beginning, does not have to be in science. But, you know, I wish I would have learned a little bit more about political science, more about finance, because those things help you in life too. But I skipped all of that because I was so focused on science. So I think going back, thinking about personal growth, probably making myself a better person. I don't think I needed all of that science as an undergraduate degree. I could have just learned things that I would never have the opportunity to learn again. I just didn't take advantage of that. So that would be something that I would recommend if you have that. That's the time to do it, is learn what you want to learn, what you're interested in, but use that for personal growth in the future. Med school, I went to the Health Science Center in San Antonio. I really enjoyed San Antonio, but obviously there's many medical schools. Being here in Texas is very unique because Texas has the most medical schools in the entire state than any other state. So I think now they have over 8, but some states don't have any. And in other states, they just have 1 for the whole state. So we have over 8, I think now. I stopped counting, but we have many medical schools in the state of Texas. So it's nice because medical schools do prefer taking in-state students versus out-of-state students. And although Texas is big, it's still per capita, or for the amount of applicants we're getting, still kind of gives an advantage to people who are from their own state, as long as you're open-minded as to where you want to go. So that's the college and medical school. From there, I actually did my residency in San Antonio as well. And so I pretty much, after college, I pretty much stayed in San Antonio. And so I started practicing. So a big question is, how do we pay for this? So there's college, and that's 8 years where you're not making money, and 8 years where bills are due, 8 years where tuition is due. And personally, for me, I just lived off of student loans. And it does get scary because halfway through there, maybe even once you start signing the medical school loans, it gets scary seeing just these loans pile up and you don't see an end to it. I would say that I had some scholarships and grants, but for the most part, it was student loans. And I think this is one obstacle that every medical student is going to face, because most people pay for undergrad school and medical school with student loans, and if it's everybody feels the same. So kind of keep yourself in an environment where you're around people, how they're managing things. You really have to make the best use of every dollar you're borrowing, so that it's not you're not wasting it, and then you don't have an enormous amount of debt when you get out. But it is really reasonable to get onto a plan that will allow you to pay them off if you actually finish. So the goal is never to do halfway. The goal is to finish. So if that's your goal, then the student loans should not be a problem. I know a lot of other people have decided to work through college, some through med school, but I can tell you that it may work through college. Working through med school is not going to be a great idea. You really need to focus on what you're there to do, and so loans will be a part of the process of getting to this point in time, at least through med school. Undergraduate, if you can manage it and work through it, that's completely acceptable. So personally, talking about my experience, I didn't leave home thinking I was going to do medicine. I left home. I went to A&M actually for their engineering program. I finished my first year there. It was a really difficult program, but at the end of the year, I couldn't say I was the most interested in engineering. But more than that, what scared me was that we went to a conference of engineering companies that were doing hiring and to do internships at their sites, and very few companies attended the year that it was my turn to intern. And that really scared me even at the student level, because I figured if it was this competitive as a student, then I was going to be having to compete at that level in my career. So I really had to sit down a heart-to-heart with myself, what I wanted to do, and I felt that medicine was a safer career path, although I couldn't tell you at that point in time what I wanted to do. So I ultimately did change out of engineering. I went into medicine route, the pre-med route, and I got in. But even when I went to med school, I knew medicine was for me. I just didn't know what specialty. So I started off with ER, and then I went into ENT subspecialties, so the emergency room medicine and ear, nose, and throat specialties. And I wanted to learn a little bit more about the ear, nose, and throat. So I went on a mission trip to Mexico, and they were supposed to have a more in-depth exposure with U.S. doctors that were helping out several communities there. They really needed help with the eyes, and not as much help. There was so much help on the ear, nose, and throat section that we spared a little bit of that help onto the eye section, which is where I came in. And unfortunately for me, at the time, I didn't realize that this was going to be a great thing for me, but they did shunt me over to the eye section. And what they were doing there was getting together some of the blindest patients in that community and operating on them. And the first day that I saw the surgeries was really boring because all I was doing was seeing people operate. But it was the next day when it was time to remove the patch, that some patients that were there being operated on that had not seen their family for 20, 30 years and have never had met some of their family members visually. Having removed that patch and being there in that room and having people see themselves jump for joy and meet each other for the first time visually, I thought that was just a very incredible experience to be a part of. And we did that several times. I think that week we operated on 200 people. So it was a very emotional week for me and a very eye-opening week for me in the sense that I came back knowing what I wanted to do. Not only at that moment, but for the rest of my life. And I'm still doing that now to this day. So that's how I got into the eye world, and I haven't looked back, and it's still every week that I operate, it's still a very good experience. And so this has led to my current passion, which is cataract surgery. It's what I do for a living. But if you talk to every doctor, there will be a story just like that moves you to do what you want to do. And I think you have to find that in medicine. And you may not always find it when you apply, but you will find it once you get there. But I can tell you that every physician shares the same stories, that they all want to help a group of people in a certain way. And they have a reason, whether it be their family members have gone through the same problems, or they have gone through those problems, or they had an experience like this trying to help someone else, and it was just overwhelming. Nonetheless, if you haven't had that moment now, it doesn't mean medicine's not for you. It just means you haven't been exposed to that type. And I wasn't exposed to it while I was in medical school. So I think it's made me a better person. So outside of the surgeries on a weekly basis, what does my day look like? Personally speaking, I have a clinic that's 8 to 5. I guess other good things about ophthalmology that it's. I'm not going to say we don't have emergencies, but they're not as common emergencies. So we do have very regular hours, 8 to 5. I do have to take call in the hospital about once every 2 or 3 months. And we interact with pretty much every specialty because the eye affects any part of the body, from the kidney disease to liver disease to heart disease and diabetes. Everything affects the eye. So we do have to work with every specialty that there is. So I like that communication. We work with other surgeons. We work with other medicine doctors to keep the patient's eyes the healthiest possible. So what skills are necessary to kind of excel in my profession? And I think, honestly speaking, that if you take a person that has the determination and the will to do good, then you're going to do well in medicine. And it really, what it comes down to is grit. Grit meaning no matter what obstacles in front of you, you're going to get up. And if you've been through a hard time, been through financially, emotionally, that's life. Everybody's going to go through that. And you'll hear in the 4 years you're in med school, 4 years you're in training, you're going to hear many stories. I had funerals to attend to. I missed birthday parties. You know, many things happened during those 8 years, but you just have to get back on and focus on your goal. And if you do that, if you have grit, you can overcome not only this obstacle, but pretty much anything that life may throw your way. So I do want to share, it's one thing to say what we experience, but another thing to show what we experience. So I want to share a little bit about what the experience is usually like during patch removal day. That's really my favorite day of the week, is the next day after surgery. And this is an example of that. So before I start the video, I just want to read the line. So this is a patient that has not seen their family in several years, and he had cataract surgery, is now about to be shown what life is like now that he can see.
Okay, Daniel, now I'm almost ready to bring your hand down from your eyes and you'll be able to see.
Ready as I'll ever be.
It's okay, honey. Everything's gonna be okay.
You're doing great, Dad.
Now here we go. Oh my God.
I might finally be able to see. I might finally be able to see my wife and daughter.
Here we go. Now you want to be very careful because your eyes will be sensitive to the light. Good. Now you
Wow!
Can you see?
Yes!
Yay!
What the heck? Come here, Alex! I want to see you close.
Say hi.
Hi, sweetie. You are more beautiful than I ever could have imagined.
Congratulations.
Thank you.
Thank you.
Thank you.
So that's just a reflection of some of the emotions that are going through, for the most part, in patch removal day for us. And so it's very, very addicting to be able to do that on a weekly basis and to have that very personal touch with these patients. And it's just something that you cannot pay for. It's a very addicting feeling to be part of, and so that's why we do it. But how do we get there? So this next video shows you very quick, maybe 2 minutes, regarding an actual procedure of cataract surgery. So how we actually get the patients to that point.
DHR Health Eye Institute.
Hello. I will briefly take you through one of my cataract surgeries. I hope you enjoy it. At this time, the eye has already been numbed, and the patient is comfortable. We enter the eye and start opening the capsule of the cataract. It's a very fine technique. The capsule is what supports the lens of the eye. The capsule will be used to support the artificial lens. The lens is separated from the capsular bag through the injection of fluid. The lens can now spin freely. I start breaking the cataract into smaller parts to allow for removal. Careful removal of all pieces begins. breakup of the cataract is done using ultrasound energy. Fine fibers can remain after the cataract is removed. These are gently removed as well, in a process called cortical cleanup. It's clean and clear now. And we're ready for the lens. Small manipulation is needed to center the lens and ensure appropriate positioning. That's it. We're done. Thank you for watching.
But a couple helpful tips from the beginning, especially for those of us going into or wanting to be pre-med. I think starting from the beginning, what you can do is being active in your community. So there's a difference between, shadowing, which is essential, I think, to know that you really want to know to do this. But having 500 hours of shadowing does not make you a better student, because you're not really helping anybody. You're helping maybe your interest, but you don't need 500 hours of shadowing to make sure that you want to do pre-med. I think those hours would probably be better used in helping other people, like visiting elderly homes or doing Habitat for Humanity, something that'll help somebody else, not just looking inside. And then that'll also look better on any application that you do to medical school. Just remember, study hard. It does take grit. It does take determination. And as long as you have that, you can overcome any smarts deficits. It's really how can you dedicate yourself to this? Because any one topic in medicine is easy to understand. You just have to be determined and take the time to understand it. Set your long-term goals. Stick to the plan. Every long-term goal is going to have bumps in it, but you have to veer yourself back onto course. And as long as you're dedicated to the plan, you should be able to succeed. And something that was very helpful for me is finding role models. So people that are just ahead of you in the same process, and people that are way ahead of you in that same process. And seek to them for guidance as to what you need to do, what you can look forward to doing, and help those people, use those people to help you attain your goals. And thank you for listening.